What is aphasia? According to aphasia.org, aphasia is an acquired communication disorder that impairs a person's ability to process language. However, aphasia is not affected by intelligence. Aphasia impairs the ability to speak and understand others, and most people with aphasia have difficulty reading and writing. What causes aphasia? Aphasia usually occurs suddenly, often as a result of a stroke or head injury, but it may also develop slowly, as in the case of a brain injury, a tumor, or dementia. Aphasia usually occurs in the left hemisphere of the brain, where it impairs the expression and understanding of language, as well as reading and writing. There are different types of aphasia. However, the two broad categories of aphasia are fluent and non-fluent. Damage that occurs in the left temporal lobe, also known as Wernicke's aphasia or fluent aphasia, can result to the right lobe as well. However, people with Wernicke's aphasia may speak in long sentences that have no meaning. They also add unnecessary words, and they even create made-up words. These patients usually have great difficulty understanding speech, and they are often unaware of their mistakes. Broca's aphasia has damage to the frontal lobe of the brain. These patients frequently speak in short phrases that make sense but are produced with great effort. People with Broca's aphasia typically understand the speech of others fairly well, and because of this, they are often aware of their difficulties and become easily frustrated. Global aphasia is another non-fluent aphasia that results from damage to extensive portions of the language area of the brain. Individuals with global aphasia have severe communication difficulties and may be extremely limited in their ability to speak or comprehend language. This is a YouTube video of a speech therapist and her patient that has Wernicke's or fluent aphasia.
Where do you live?
Where do you live? You are up here, see?
Where do you live, Doc?
Where do you live?
Where do you live?
Where do you live is, well, it's right in front of here, around here. You?
Who can acquire aphasia? There are approximately 80,000 people who acquire aphasia each year. Currently, there are about 1 million people in the USA with aphasia. The majority of people who have aphasia are middle-aged and older men and women equally. Children also have the ability to acquire aphasia through stroke or traumatic brain injury. Any age or gender can acquire aphasia.
General findings for spoken output difficulties that are caused primarily by difficulties in assessing word forms. Therapy should include tasks that focus on producing spoken output or silently assessing phonological word forms. These may include, for instance, phonemic cueing for spoken output, cueing spoken output with written letters, repetition, rhyme judgment, and reading aloud. An apraxia treatment for spoken output difficulties that are caused primarily by difficulties in assessing and sequencing the sounds within words, therapy should include tasks that focus on the structure of word forms. These might include, for instance, listening to differences between spoken words, repeating words of increasing length, strengthening links between written spelling and spoken word forms, and developing skills in self-monitoring of spoken output. AAC, Augmentative and Alternative Communication, is a set of procedures and process by which an individual's communication skills, like production and comprehension, can be maximized for functional and effective communication. It involves supplementing or replacing natural speech and/or writing with aided device symbols, such as pictures or tangible objects, and etc. Or unaided production symbols such as manuals or gestures. Conversation partner training approaches is where impairments are primarily at the level of spoken word comprehension. Therapy should aim to improve access to word meanings. For cueing strategies, for spoken output difficulties that involve difficulties in phonation and processing word meaning, otherwise known as semantics. Phonation, where impairments are primarily at the level of speech sound perception, therapy should aim to improve discrimination of speech sounds. Semantics, where impairments are primarily at the level of word processing, therapy should include tasks that focus on semantic processing. These might, for instance, include semantic cueing of spoken output, semantic judgments, categorization, and word-to-picture matching. With computer-based treatment, computer-based therapy offers a potential to provide intensive home-based therapy with minimal clinician input. Improvements in performance over a number of communicative modalities can occur. A part of language-oriented therapy is functional communication. Therapy needs to promote generalization of learned strategies. Therapists should involve communication partners in therapy and conduct therapy within natural communication environments. By use of multimodal treatment, therapists can use specific training in the development and/or refinement of nonverbal communication strategies. Is required for these to be used efficiently and effectively. Ideally, these strategies should be used when a total communication approach that promotes the flexible use of different physical therapeutic agents in communication to improve communicative effectiveness. In reading treatment, when there is a letter recognition deficit, therapy should aim to improve the speed and efficiency of letter identification. When there is a deficit in recognizing irregular or written words, semantic approaches are helpful. If there are problems in assessing phonology from orthography, which is spelling of the language, then therapy including retraining grapheme to phoneme correspondence can be helpful, in some cases in combination with a semantic component. In writing treatment, once the level of breakdown in writing has been established, therapy can focus on training the impaired component by slowing/increasing focus on handwriting or by using intact mechanisms to compensate for the impairment. Another part of language-oriented therapy is script training. SLPs are able to target both the underlying language deficits in aphasia and the psychosocial implications. They develop and short scripts about topics with real word and personal significance. Now, in word-finding treatment, greatest influences on picture naming for trained words is to increase treatment effects to untrained words and sentence context. Alright, so the last of the language-oriented therapy is melodic intonation therapy, which is a type of singing style that is supposed to stimulate the intact right hemisphere in order to facilitate speech recovery. The common words and phrases are turned into melodic phrases emulating typical speech, intonation, and rhythmic patterns. Next we have aphasia therapy planning in language. The assessment should focus on the nature and extent of the speech and language impairment and level of preserved abilities. Careful assessment is needed to identify the nature of the sentence processing impairment. This should be hypothesis-driven and may include tests of verb and sentence comprehension and analysis of verb, sentence, and narrative production. Functional and pragmatic aspects of communication, including compensational strategies. And the last is psychosocial well-being. Incorporation of many aspects of your assessment is very important. For the assessment, it should be purposeful and may occur during any stage of intervention. It may incorporate interview, conversation, observation, and formal and informal assessment tools. Additionally, the impact of the communication disability on the lives of the individuals and close others and may include an assessment of the skills of the communication partners. Alright, so lastly, your pre-post therapy assessment should explore speech production in open conditions such as narrative and conversation, as well as constrained conditions such as picture descriptions. Another part of therapy planning is for the auditory processing. In auditory processing, careful assessment is required to identify the presence, nature, and severity of an auditory processing impairment, which may be difficult to detect in conversation or informal tasks. Assessment should consider the individual's skills in speech-sound discrimination, spoken word recognition, and spoken word comprehension, as well as the possibilities of coexisting hearing loss or essential auditory processing disorder. With aphasia patients, it's very important to consider the therapy planning that's needed for both the reading and writing. In reading, prior to word reading, the pre-morbid literacy, visual acuity, and visual neglect need to be considered. An assessment of reading must consider how the individual uses reading in everyday life in addition to his or her orthographic, phonological, and semantic processing of written words. Assessment may involve letter and word recognition, reading aloud, reading comprehension, letter use, and use of words and non-words. Okay, so lastly, I want to discuss writing. It's a thorough assessment which needs to consider how the individual uses writing in their everyday life. It also needs to incorporate analysis of semantic, orthographic, and phonological processing of written words. Lastly, a really neat thing I want to talk about is the activities that you can do with your aphasia patients. Alright, so the first point is vocabulary, which is just like an iPhone app developed for communication, information, and fun. Words are made available based on your GPS location, so it's easily spoken and the right words in the right place. Another one is Speak in Motion, which is VAST. VAST is an innovative application of video technology to facilitate and improve communication abilities for speech-impaired individuals like aphasia patients. So, following close-up videos of mouth movements allows these individuals to speak full sentences. The simultaneous combination of visual, auditory, and, in some cases, written cues allows these individuals to readily produce speech. The third app is a Tactus therapy solution. This one is specialized for adult rehab and bringing evidence-based therapy to the touchscreen with respectful and intuitive design. Alright, and so the last one is Vocabeans. Each Vocabean bundles a picture and audio together to represent a word that might be difficult for the user to say. The Vocabean software product contains hundreds of pre-built Vocabeans and allows you to create your own right from your iPod or iPhone. So this one is very personalized, but yet at the same time it's also very helpful with having that picture and audio together.
The increase of technology has made many apps available for SLPs to use in therapy and allows patients also to take home and use this as outside therapy outside the clinic. Using an iPad or an iPhone or any electronic device where you are able to download these apps and use for yourself. Here are several apps that we found regarding aphasia. The first app is Aphasia by Lingraphica. This app guides adults with aphasia through a series of exercises designed to improve overall speech. This app has 3 stages that you can start on, from easy, which contains 2 word phrases, and then following is medium, which will contain 3 word phrases, and the third is hard, with 4 or more word phrases for each prompt. Each prompt includes an image, sound, and text. Also has a cute button to give you a little extra information about the picture as patients after they answer to get a little bit more information of the picture. Here we have an iPad to show how you can use the apps. You can do it off an iPad, an iPhone, or like I said, even off a computer with any electronic device, as long as you can get the app and download it. And here's our first step that I just talked about, Lingraphica with aphasia, and we'll click it. And then it'll bring you to the menu screen, And it has 6 different categories that you can go to. And we're gonna go with naming with cueing, and we'll just press it.
Naming with cueing.
And then they give you the 3 options, like I said earlier, with easy, medium, and hard. And we'll go with easy.
Easy.
We'll click it. And then once you're ready, press start.
Start. Name the item below. Touch the hint button for cues.
And after that, the patient can say it, whatever they think it is. And once they say it, they can click on it.
Flower.
And they'll give you the answer. And then after that, let's go to next.
Name the item below. Touch the hint button for cues.
And then once they get those, you could go, if that's too easy, go to exit. And you could go try the hard, and they'll give you different options. Give it a second, press start.
Name the item below. Touch the hint button for cues.
And as you can see, like, the pictures will be a little bit difficult, and if they have still a question, you press the hint.
A public place to wash clothing.
And they'll give them a better vocabulary word to see if they can get the answer with the hint. And then same thing again. Just
Laundromat.
click it, and there you go. And then we can go back to home, and then you could try one of the other ones, and we'll give you another example down here.
Flashcard naming.
And we'll go with medium.
Medium. Start. Name the item below.
And then they could say it, and then click it again.
Watch.
And it tells them the name and the proper way to say it. And this is how this app works. And it's pretty simple. And like I said, you could take it home, anywhere on the go-to, and it's very easy for therapy as well, for SOPs to use. Our second app will be Aphasia by Graphica again, and this one is a good one because it helps you communicate with friends, or if you go to a restaurant or you want to go to a restaurant, like, it gives you choices of restaurants, and you click it and it'll say the name for you. Also, if you need to use the phone and stuff, like, it has all these categories that you can choose, and we have it here on our iPad, as you can see. And then we'll click on it and pull it up, and it's very simple. It gives you the icons, and it also gives you videos, and the videos help with, once you click it, it will say the phrase, and it also has a person saying the words, so it gives you a chance to read the lips and make sure you're pronouncing it right. And we'll go with the icons first. Like I said, if you're in a conversation and you want to answer,
Yes.
and it'll say it for you. If you're talking to somebody and you want to tell them good morning, just click it.
Good morning.
And it says it for you. And here we go. Let me take you down to the restaurants. It has all the breakfast, lunch, iced tea. Say you want to go to Wendy's and you can't say, you click on it.
Wendy's.
And it'll bring it up, and you can show it to whoever you want to showing it to. And then say you're at a basketball game, football game, and you want to go to the concession stand. Say you want a hot dog, and you just be like, click it.
Hot dog.
And it'll relate the message. And we'll go back, and I'll take you to the videos now. And this is what I like about the app. So we'll pick a basic.
I love you.
So, like, it'll give you the lip structure of how they say it, and it gives you a chance to say, and you can practice on your own. It has a lot more. It has the days of the week. We'll go with Wednesday.
Wednesday. Wednesday.
And these are repeated twice, and then, like, you could go to the settings and you could change it if you want it to repeat slower or faster. And it gives you the option, and also it gives you the option to hear it from a male's voice and a female's voice. So whichever one you feel more comfortable with, you just go to the settings and you could get all that taken care of. And so I think this app's pretty cool just for the fact that it helps you communicate with other people better, and it helps in therapy as well if they're shy to talk. And like I said, the videos are good. That helps a lot with the lip structure. If they're trying to pronounce it, like they could work without saying the word, they could just work with their lips, and then after a while they could start producing the sound. And here we have our last step, will be a speech to go, and this one's like pretty basic, real simple to use. Pictures are good quality, and it's just basically you could take it anywhere on a trip, or good for the classroom and for therapy as well. And here you see pulls up real fast. You see the chimp, and then you can ask the patient to name it. Once they say it, they could press
chimp,
play, and then they can press as many times as they want so they can get a good hearing of the word. Slide
branch,
it, and a new one comes out, and just
bench,
it gives you 20 on the first one. After you get all 20, you'll click at the top and then go to library, all positions, and then it'll give you some more, and it'll just take you through them. And like I said, just keep
furniture,
sliding. And the pictures are actually pretty good, so that's a good thing about this app. Like, they're real basic, and like, as you can see, child's a baby, so like it's not too hard. The pictures it don't make the patient think, like get lost in the words. And like I said, this one's pretty basic. You could take it anywhere. Like, it's, the app says that it sells speech on the go. So this one's this app, and this is our last app. And like I said at the beginning, with the technology nowadays, like, it makes it a lot easier for us as SLPs to give therapy. And with these apps, like I said, you could iPad, iPhone, whatever. As long as you could download the app, it's good. And like, technology nowadays, like, a lot more people are using it, and it saves you the trip. If you live an hour away from the clinic, like, get an iPad, iPhone, and you can have your own therapy sessions at home, and you can practice, and it just makes our job easier, and it makes their life a lot easier too if they're into technology. So technology is great for all these apps, and with aphasia, like, you know, hopefully the treatment over the years is going to get better, and it just helps the patients and us, and just gives us a good understanding of everything that goes on in our jobs.
Emotional feelings that arise with aphasia. For the person with the disorder, they might have feelings of frustration, helplessness, anger, depression, guilt, and embarrassment. And these all come attributed because they are unable to communicate with their loved ones, or just to simply order a meal if they have to. Emotional distress for the family would be feelings of anxiety, anger, confusion because they don't understand what is happening to their loved one, despair, depression, and sense of loss. The first step in the adjustment process is to inform the family and person dealing with the disorder what it means to have aphasia. Typically, an SLP can provide this information as well as a personal evaluation of the patient's abilities with the comprehension and expressive communication they will have to work with. Some of the coping strategies to help a patient with aphasia is to talk to them as an adult. Don't treat them as a child. You can also communicate through touch, simplify your sentences, and slow down your pace. Give the person time to talk, and don't speak for them. You may also want to keep paper and pen handy, or any electronic devices that may be used. Another great option for them is to speak to them with no distractions in their environment, so you can focus on one-on-one. Coping strategies for the family. The family also needs to acknowledge that it will be frustrating for them to deal with somebody with aphasia. They need to be actively involved in evaluations and treatment options. They need to get enough sleep. Try to maintain a social contact with everyone else. Keep leisure activities to reduce stress. And avoid major life-changing decisions, for example, moving or getting a new job.
The clip that I'm about to show y'all is an interview of a patient and his therapist with a non-fluent aphasia. After he is finished with his interview, the therapist will then show her interview with his wife.
So who are you?
My name is Michael Caputo.
So what is it that you do, Mike?
Well, I am Voices of Hope, Aphasia.
Do you have aphasia?
Yes.
How does somebody get aphasia?
Well, it's my speech. It's going three words are going yuck. It's like my good from my good, very good, but no here.
Would you say that when people tell you that after 6 months you can't get any better?
No. We gotta, if you gotta work it, you gotta work it. You gotta work it.
Is there anything you'd like other families struggling with aphasia to know?
My words that I live by is that every day I wake up hoping for a new word, or a gesture. Something to better communicate with my husband. Don't ever give up.
And how does Mike, as a young person with aphasia, how does he deal with this?
Mike struggles to get out of it. But he does because he knows that he comes to the center every day and is socializing with those with aphasia where he feels comfortable. He is surrounded by speech therapists, which he is blessed by because they encourage him to speak, they help him speak, and that's what gives him life.
So Arvilla, you have...
There are many support groups around the internet that one can join, but the one close to Texas in our area would be at BSA Hospital. The contact person would be Maggie Steer, and they get together every Wednesdays at 6 p.m. Another center would be the Wellness Center in Arlington, Texas. Contact would be Karen Berry, and they also meet every Thursday, or you can join an online support group. Although aphasia is usually affecting older populations, there are those who are younger. Some support groups such as YES, Young Enthusiastic Stroke Survivors, and Young Adult Stroke Survivors program offer the younger population the ability to be able to communicate with others that are their same age and feel more comfortable speaking with one another. The National Aphasia Association offers a multicultural task force, which allows different SLPs in different native languages to be at hand for any individual that has an aphasia. They are those that are bilingual in English, Hindu, and those that are more common as Spanish to English. They're also French and Spanish, and those who are such as German. This allows the patients with aphasia to have a more wider option to be able to get therapy in their native language.
In conclusion, I want to talk about pretty much the basics of aphasia. Aphasia is not only invisible, it is silent. Aphasia is an impairment of language affecting the production or comprehension of speech and the ability to read or write. Aphasia can be so severe as to make communication with the patient almost impossible, or it can be very mild. It may affect mainly a single aspect of language use, such as the ability to retrieve the names of objects, or the ability to put words together into sentences, or the ability to read. More commonly, however, multiple aspects of communication are impaired while some channels remain accessible for a limited exchange of information. It is an acquired disorder of previously intact language ability secondary to brain disease. Aphasia plays no favorites as to who it can affect, so it can affect all age groups. People with aphasia come from all races, educational, and socio-economic groups, and the loss of profound changes in the ability to communicate challenges the inner being of the patient with aphasia or motor speech difficulties. It will also disrupt his or her family, work, and social environment. So this can be a very depressing time and very stressful for the patient. So therapy is usually a very long-term process. Alright, so I just basically want to go back over the 5 different aphasias real quick. The global aphasia is the most severe form of aphasia and is applied to patients who can produce few recognizable words and understand very little or no spoken language. Global aphasics can either read or write. Global aphasia may often be seen immediately after the patient has suffered a stroke, and it may rapidly improve if the damage has not been too extensive. However, with greater brain damage, severe and lasting disabilities may occur. In Broca's aphasia, it is a form of aphasia in which speech output is severely reduced and is limited mainly to short utterances of less than 4 words. Vocabulary access is limited in persons with Broca's aphasia, and their formation of sounds is often laborious and clumsy. The person may understand speech relatively well and be able to read, but be very limited in their writing. Broca's aphasia is often referred to as a non-fluent aphasia because of the halting and effortful quality of speech. Okay, remember now, with mixed non-fluent aphasia, it is applied to patients who have sparse and effortful speech, resembling severe Broca's aphasia. However, unlike people with Broca's aphasia, these patients remain limited in their comprehension of speech and do not read or write beyond an elementary level. In Wernicke's aphasia, the ability to grasp the meaning of spoken words is chiefly impaired, while the ease of producing connected speech is not much affected. Therefore, Wernicke's aphasia is referred to as a fluent aphasia. However, speech is far from normal, sentences do not hang together, and irrelevant words intrude sometimes to the point of jargon in severe cases. And with Wernicke's aphasia, reading and writing are often severely impaired. With anomic aphasia, it is applied to people who are left with a persistent inability to supply the words for the very things they want to talk about, particularly the significant nouns and verbs. As a result, their speech, while fluent in grammatical form and output, is full of vague circumlocutions and expressions of frustration. They understand speech well and in most cases read adequately, but they have a difficulty in finding words, which is evident in writing as in their speech.